Amyotrophic lateral sclerosis, ALS. ALS is a disease that gradually paralyzes the body. It damages the nerves that send signals from the brain to the muscles. Without these signals, muscles start to weaken and waste away. It often begins with small signs, maybe a slight weakness in the hands or difficulty walking steadily. As time goes on, the weakness spreads, making it hard to move, speak, swallow, and eventually breathe. The mind stays sharp, but the body can't respond. When thinking about someone who lived with ALS, Stephen Hawking often comes to mind. It began with weakness in his hands and legs, and soon he couldn't walk. Over the years, he lost the ability to move or speak entirely. He relied on a wheelchair and a computerized voice to communicate because ALS took away all his muscle control. Huntington's disease. Huntington's disease is a condition passed down through families, caused by a faulty gene that damages brain cells. It often starts in adulthood, usually in someone's 30s or 40s, and comes with a combination of physical, emotional, and mental symptoms. At first, there may be small, jerky movements or trouble keeping balance. These involuntary movements, called chorea, get worse over time, making walking, eating, and speaking harder. Emotionally, it can bring mood swings, irritability, or even depression. Thinking and memory also decline as the disease progresses, leaving everyday tasks almost impossible. If you've heard of Woody Guthrie, the famous folk singer, you might know he lived with Huntington's disease. He experienced uncontrollable movements in his body that grew worse as time went on. He also struggled with emotional instability, which made it hard to connect with others. In the later stages, he was no longer able to care for himself, as both his body and mind were deeply affected. Stroke. A stroke happens when blood flow to the brain is interrupted. This can be caused by a blockage in a blood vessel, known as ischemic stroke, or by a blood vessel bursting, known as hemorrhagic stroke. Without oxygen, brain cells start to die within minutes, leading to sudden and often serious symptoms. These can include weakness or paralysis on one side of the body, slurred speech, difficulty understanding others, or a drooping face. The effects depend on which part of the brain is affected. Some strokes cause confusion or loss of balance, while severe ones can leave a person unable to move or speak. Richard Nixon is an example of someone who suffered a stroke. Late in life, he had a major stroke that left him partially paralyzed on the left side of his body. He also lost the ability to speak clearly, which is common when strokes damage the areas of the brain that control language and movement. Alzheimer's disease. Alzheimer's disease is a condition that slowly damages the brain, affecting memory, thinking, and behavior. It starts small. Someone might forget recent conversations, misplace items, or struggle to recall names. Over time, these lapses grow worse. Familiar places feel unfamiliar. Loved ones' faces become hard to recognize, and even basic tasks like dressing or eating require help. In its later stages, the person may lose the ability to communicate entirely and need full-time care. The changes happen gradually, but they profoundly affect the person and their family. A famous example of this disease is Ronald Reagan. In his later years, he started forgetting names and events. As the disease progressed, he became increasingly disoriented, often unable to recall people he once knew well. Eventually, he required round-the-clock care as Alzheimer's took away his ability to communicate or perform daily activities on his own. Parkinson's disease. Parkinson's disease is a condition that affects the brain's ability to control movement. It happens when certain brain cells stop producing dopamine, a chemical that helps muscles work smoothly. At first, the symptoms are subtle. A slight tremor in one hand, stiffness in the arms or legs, or slower movements. Over time, these symptoms get worse. Walking becomes unsteady, balance is harder to maintain, and facial expressions may fade, giving a mask-like look. Speech can also soften or slur, and handwriting often becomes small and shaky. One famous person with Parkinson's is Michael J. Fox. He first noticed tremors in his hand, which made tasks like holding objects more difficult. As the disease progressed, he experienced stiffness and slowed movements that made walking and balancing harder. These are classic signs of Parkinson's, which gradually affects nearly all aspects of physical movement. Looking to stay active and energized? Hit subscribe and discover simple steps to better health. Migraine. A migraine is far more than a headache. It's a neurological condition that can affect the entire body. It usually begins with a throbbing pain on one side of the head, but it often comes with other symptoms like nausea, vomiting, and sensitivity to light and sound. For some, it starts with a visual aura, flashing lights, zigzag patterns, or blind spots. Migraines can last for hours or even days, and the pain can make it impossible to focus or carry out daily tasks. Triggers like stress, lack of sleep, or certain foods can make them worse. Serena Williams, the tennis legend, has experienced migraines that caused intense head pain during her matches. Bright lights on the court made her symptoms worse, leaving her struggling to focus while dealing with the pounding pain and light sensitivity that are typical of migraines. Myasthenia gravis. Myasthenia gravis is a condition where muscles become weak because the connection between nerves and muscles is disrupted. It's caused by the immune system mistakenly attacking this connection. The weakness often starts in the eyes, causing drooping eyelids or double vision. Over time, it can spread to muscles used for chewing, speaking, and even breathing. The symptoms tend to worsen with activity and improve with rest, making daily tasks feel exhausting. In severe cases, it can affect muscles that control breathing, creating life-threatening complications. Imelda Marcos, the former First Lady of the Philippines, experienced symptoms of myasthenia gravis. She struggled with muscle weakness, particularly in her face and throat. Speaking and eating became increasingly difficult for her, especially after long days when her muscles were more fatigued. This pattern of worsening weakness with use is a key feature of this condition. Stiff person syndrome, SPS. Stiff person syndrome is a rare neurological condition that causes muscles to become rigid and stiff. It often starts with stiffness in the lower back or legs, making it hard to move freely. Over time, the rigidity spreads to other parts of the body, and sudden muscle spasms can occur, triggered by stress, noise, or even light touches. These spasms are not only painful but can also make walking and everyday tasks extremely difficult. In severe cases, the stiffness can cause a person to appear frozen in place and unable to move. One example of someone diagnosed with SPS is Celine Dion. She shared that she experiences intense muscle stiffness in her torso and legs, which affects her ability to walk or perform. Her symptoms include painful spasms that often affect her movement, showing how difficult it is to live with this rare neurological condition. Encephalitis, lethargica. Encephalitis, lethargica, also known as sleeping sickness, is a rare and mysterious condition that affects the brain. It causes extreme drowsiness, sluggish movements, and in severe cases, a frozen, unresponsive state. Some people appear awake but are unable to move or speak, while others experience tremors or difficulty controlling their muscles. This condition gained attention during an epidemic in the early 20th century, leaving many patients trapped in a state of slow motion for years. Its exact cause is still unknown, though it is believed to involve inflammation of the brain. Mervyn Peake, the author of Gormenghast, is believed to have suffered from this condition. He experienced severe fatigue and motor difficulties that made simple activities hard to manage. Over time, these symptoms worsened, leaving him struggling with daily tasks as his body grew weaker. Multiple sclerosis, MS. Multiple sclerosis is a condition where the immune system attacks the nerves, specifically the protective layer called myelin. This damage disrupts signals between the brain and body, causing a wide range of symptoms. Some people experience blurred vision, numbness, or a tingling sensation in their limbs. Others might feel weakness in their muscles, struggle to walk, or get so tired that even small tasks feel overwhelming. The symptoms can come and go, or they might steadily get worse over time, making it hard to predict how the condition will progress. MS can also affect balance and coordination, making daily life a challenge. Selma Blair, an American actress, is an example of someone living with MS. She experienced weakness in her legs that made walking difficult, along with tremors that threw off her balance. She sometimes relied on a cane or wheelchair as her fatigue and muscle problems worsened. It's never too late to prioritize your well-being. Subscribe and let's unlock a healthier, happier you. Epilepsy. Epilepsy is a condition that causes seizures due to abnormal electrical activity in the brain. Seizures can take many forms. Some are brief moments of confusion or staring, while others involve violent shaking and loss of awareness. The episodes can strike without warning, making everyday life unpredictable. Some seizures are triggered by flashing lights or stress, while others have no obvious cause. Over time, the condition can affect memory, mood, and overall quality of life, depending on how often the seizures occur and which part of the brain is involved. Neil Young, the legendary musician, is an example of someone living with epilepsy. He experienced unpredictable seizures that sometimes left him unconscious or disoriented. These episodes made it challenging for him to carry on with normal activities. Dementia. Dementia is a condition that affects memory, thinking, and decision-making. It isn't a single disease, but a collection of symptoms caused by damage to the brain. Early signs might include forgetting names, losing track of time, or misplacing everyday items. As it progresses, dementia can make people confused about where they are or who they're with. Eventually, even basic tasks like eating or dressing become difficult. One form, Lewy body dementia, also causes hallucinations and tremors, making it especially tough for patients. Robin Williams, the beloved actor, lived with Lewy body dementia. He experienced serious hallucinations that left him disoriented and anxious. Over time, these symptoms worsened, leaving him unable to function as he once had. Tourette syndrome. Tourette syndrome is a condition that causes sudden, uncontrollable movements, or sounds, called tics. These tics are the result of signals from the brain that the person can't control. Some tics are simple, like blinking or sniffing, while others are more noticeable, like jerking the head or making sudden sounds. The tics can change over time, and stress or excitement often makes them worse. While Tourette's doesn't affect intelligence, the constant nature of the tics can make everyday activities harder, especially when the tics are frequent or severe. If you're wondering about someone with Tourette syndrome, Tim Howard, the famous soccer goalkeeper, is an example. He experienced shoulder shrugs and facial twitches, which often became more noticeable during intense matches. These tics affected how he moved on the field, a common experience for those living with this condition. Prosopagnosia. Prosopagnosia, or face blindness, is a condition that makes recognizing faces extremely difficult. It's not caused by bad memory or poor eyesight. It happens because the brain can't process the features of a face as a whole. People with prosopagnosia often rely on clues like voices, hairstyles, or clothing to figure out who someone is. This can make social interactions awkward or stressful, especially when meeting new people or recognizing acquaintances. For some, even identifying close family members can be a challenge. Everyday situations like attending events or running into someone familiar can feel confusing and embarrassing. Popular actor Brad Pitt has spoken about his struggles with this condition. He found it hard to recognize even close friends and often relied on context or other hints to identify people, which made social interactions frustrating and uncomfortable for him. Autism spectrum disorder, ASD. Autism spectrum disorder is a condition that affects how people communicate and interact with others. It can look very different from person to person. Some people may have trouble understanding social cues or making eye contact, while others might focus deeply on specific interests and have amazing skills in certain areas. Many people with ASD are sensitive to things like loud sounds, bright lights, or certain textures, which can feel overwhelming. Some may not speak, while others can talk easily but still find social situations hard. Temple Grandin is an example of someone with ASD. As a child, she avoided loud noises and disliked certain textures because they overwhelmed her senses. She also struggled to connect with other people, finding social situations confusing and difficult. Gullian-barré syndrome, GBS. Gullian-barré syndrome is a rare condition where the body's immune system attacks the nerves by mistake. It often starts with tingling or numbness in the feet and hands. As the condition worsens, the weakness spreads upward, making it hard to walk, move the arms, or even stand. In serious cases, it can affect the muscles used for breathing, which can be life-threatening. The symptoms usually come on quickly, often a few days after an infection like the flu or a stomach virus. Although most people recover, the process can take months or even years, and some may have lasting weakness. If you're curious about someone who may have experienced GBS, Franklin D. Roosevelt is believed to have had similar symptoms. His condition caused paralysis in his legs and later affected his upper body, leaving him unable to walk without assistance. Thank you for watching. If you enjoyed the video, please consider subscribing and liking the video. It helps us out a lot.